You're listening to the Mother to Baby podcast, medications and more during pregnancy and breastfeeding. Ask the experts with your host, genetic counselor and mom of four, Chris Stallman.
Welcome to another episode of the Mother to Baby podcast. My name is Chris Stallman, and I am a mother of four. Finally got that intro updated. Thank you very much. Also a teratogen information specialist and a genetic counselor. So as a teratogen information specialist, what I do is talk to people about different exposures that can happen during pregnancy, during breastfeeding, before a pregnancy happens, or in cases of adoption. And an exposure can be anything. So it could be a medication, it could be a vaccine, it could be hair dye, it could be acne products, it could be anything. And there are lots of questions out there, and that's what Mother to Baby is here to do. We're here to answer those questions from patients, their families, and providers as well. Today, we are actually going to ask a slightly different kind of expert. So like I said, I'm a genetic counselor, but today on the show, we have a clinical pharmacist. Christy Pratt is a clinical pharmacy specialist at Kaiser Permanente in Colorado. She works mainly with primary care, OBGYNs, maternal fetal medicine and pain management, also with cardiology. And for all of these specialties, she provides educations to both patients and providers. And something really cool is she started an interdisciplinary program, so a bunch of specialists working together, where pharmacists outreach to newly pregnant patients to discuss the risks and the benefits of medication during pregnancy and breastfeeding. Christy is also a member of the Organization of Teratology Information Specialists, otherwise known as OTIS. And OTIS is the research arm of Mother to Baby. So we're all part of the same organization. We just do slightly different things. And so Christy's background and providing this information is really similar to what we do at Mother to Baby. She lives in Erie, Colorado with her husband, her daughter, 3 horses, 1 dog, 5 chickens, and a mule. And honestly, I think that's such a cool and interesting thing. Christy, thank you so much for joining us on the show today.
Thank you so much for having me.
I have to know, what is the name of your mule?
Her name is Millie.
Awesome. Like short for Millicent or just Millie?
Some days I think it's short for militant.
Nice. Very, very cool. Christy, why don't you tell our audience a little bit about how your role works and how you get information about exposures during pregnancy and breastfeeding to the people asking these questions?
Okay. So, I have an office. Again, I'm a clinical pharmacist, so I have an office in a doctor's office. I work for a managed care organization, so we're kind of all together. So there's specialists and primary care providers here. And I'm kind of right in the middle of all of them. So pediatrics is really close, primary care is really close, and the OBGYN doctors. In fact, maternal fetal medicine also has an office next door that they're at half the time. And so I'm around a lot of different doctors who ask questions about medication use in pregnancy and lactation. So I might have a pediatrician come and ask me what would be a good option for this mom who's having X, Y, or Z happening, and she's breastfeeding her 2-month-old. I might have an OBGYN come up to me and say, I have a patient who's pregnant and she's on these medications. Can you outreach her and discuss kind of the risks and benefits? Or I have the patient here. Can you give me some information that I can pass along to her? I also get these similar questions from primary care, or they may say, hey, I have a patient in the office, or I need you to contact, who is thinking about pregnancy and would like to know the risks of medication use. She's on 3 or 4 medications in pregnancy.
That's so great that you are a knowledgeable resource. And I'm so glad to hear that providers are asking these questions. I mean, we do get provider inquiries through Mother to Baby, and it's always wonderful when they're able to take that next step and say, you know what, this is my professional opinion. However, I still can double check or ask an expert who specializes in this field, just to give that extra little bit of patient care. So I'm really glad you're in that role. I'm really glad those roles exist and that your colleagues are asking these questions. What are some of the common things, or maybe even the most common thing, that you consult on?
So one of the most common requests that I get is to review medications for depression and anxiety in pregnancy and postpartum. So when I talk to people about medications in pregnancy, specifically the antidepressants or the anti-anxiety medications, I like to use an analogy. I tell patients that their coping ability is basically kind of like a glass of water. And when our glass of water is full and we're able to kind of take things as they come. So any sort of stressors, we will pour out a little bit of glass of water, but we still have plenty left in there for us to maintain, again, our coping skills and our mood overall. But as things build, as we get more and more stress, we pour out more and more water. So new mom, baby's not sleeping, pour out a glass of water. The dishes are starting to pile up, pour out some more water. Your house is a mess, pour out some more water. So there's lots of different things that can take away our water. And we have ways of refreshing that water, right? So we can exercise, we can eat healthy, we can get good sleep, we can spend time with our family. There's lots of things that can refresh those, but there's lots of things that can deplete them. And so trying to find that balance of keeping our glass of water as full as possible can be really challenging, especially in a new mom or in a pregnant mom. And so what I try to do is reassure patients that when we're using medications, we're basically using medications to refill your glass of water. There's nothing wrong with you in the sense of that you're broken or there's no issue there. We're just trying to help you sustain your glass of water so you can help with your day-to-day activities and functions so that you can help take care of your family and go to work if you're going to work, or take care of that baby when you haven't been sleeping.
I like being able to visualize a glass of water. And when you said, the different things that take away from it, whether, they're things that eventually may be a positive or a negative, I'm just visualizing, the water getting lower and lower and lower. And I think that that's really helpful because speaking from personal experience and from professional experience, patients that I've counseled over the years, in so many cases, the parent is always thinking about everyone else first. They're thinking about their partner or spouse. They're thinking about their children, however many they have. They're thinking about their other family members. They're thinking about their work and their work colleagues, So very often parent comes last, especially female parent for some people. And just keeping in mind that, we absolutely need everyone caring for children to be as healthy as they possibly can be. And mental health is included in that. It's one of those things where it's not as much talked about as maybe it should be. And, sometimes it goes overlooked, but that doesn't make it any less important, especially in pregnancy, especially in that postpartum time, anytime, not just right after the baby's born. My youngest is now about 15 months. And of course, we're still sort of coming off and still really in part of the pandemic, and things are hard. Things are tough, and that changes over time, and hopefully things continue to get better. But sometimes it's a long time before you see a big difference, and being able to care for yourself as well as the people around you helps get through those really tough times. So I appreciate, that you can give them information about the medications, absolutely. But I think the bigger message that I'm hearing from you now is, yes, this is what we do. And the reason that we do it is to try and achieve that balance so everyone's needs are met appropriately.
Yeah, no, I agree. And I think that there's so many times I talk to patients that, and again, sometimes they're in the pregnancy, postpartum period, or sometimes when they're dealing with, family members at the end of life on the other side. And we always hear about, you need to make sure you have self-care, you need to make sure you have self-care, you have to take care of yourself to take care of other people. But sometimes that can be a very nebulous thought process, okay, of course I need to take care of myself. I'm feeding myself and I'm getting some sleep. I'm taking care of myself. But when you put it in the analogy of that glass of water being really close to empty, I think it's easier, like you said, for you to visualize what's going on emotionally and psychologically. And, I guess the reason that I was able to kind of put that together is there were days I can be a total rock star with my little bug, and we go and we play and we do all these things, and I have so much patience, and she throws a temper tantrum, and I'm fine, and it's okay. And there's other days that I can't. It's so hard. Every time she throws a temper tantrum, I'm frustrated, and I don't know how to process that. And I think when I think about on the good days, the rock star days, my glass of water is really close to full. And those really struggle days are the days that it's close to the bottom. And realizing how to try to think about self-care in that way I think is an easier way for patients to think about treatments and how to treat themselves and take care of themselves, because what fills your glass? And if we don't have enough things to fill your glass, what can we help you fill your glass with?
That's a great point. And I know exactly what you're saying about self-care. It's one of those buzzwords. You see it everywhere. And, for a long time, I struggled with how do you do self-care, because I've read things, get your nails done. You know what? That's not my thing personally. Go get a facial, go get a massage, go sit in a bubble bath. And, it's not one size fits all. It doesn't work for everybody. So like exactly what you just said, knowing what fills your glass, not your mother's glass, not your sister's glass, not your best friend's glass, not your partner's glass. What does it for you? And I think that that's really helpful. I think that one of the endpoints that we often get to is burnout. So people say, I'm burnt out, but that's the end point. When you're visualizing the glass going down, you're saying, I don't want to get to that end point. I want to stop it before I'm at a place where things become unmanageable. And for some people, medical interventions, medications, and other things are what helps make sure that water doesn't run out.
Yeah, and I think especially, when you're trying to have that risk-benefit conversation with a healthcare professional, it's nice to be able to put it kind of in a way that you can process the information. And, I've had the conversation with some patients about their antidepressants, and they've said, I don't feel like I need it. I've not felt like I've needed it for a long time. I think I'm comfortable with stopping it based on risk and benefits. I've had other patients say, this thought of decreasing my dose of this medication makes me think that I can't function on a day-to-day basis. And so again, it's a very individualized thought process about those risks and benefits. Some patients can come down off the medication and they feel fine and they're great. There's no issue. Some patients try to come down and they reassess, they're unable to, and other patients realize that based on their glass of water and based on their personal needs, they need to stay on it. And I think that's the most important part of these conversations, because they're never the same. It's not one size fits all. Here's the data we have. Now, what do you need, and how does this data fit into that?
Yeah, I think that's a good point. That exactly what you said. One size doesn't fit all. And it's, again, I'm just so grateful that providers are not just yanking people off medications just because they're pregnant or just because they're breastfeeding, which is a monumental thing, but it doesn't automatically mean that you have to come off. And as you said, in some cases, even lowering the dose is not going to work for some people. And I so appreciate that patients are willing to say that. I appreciate that providers are willing to consider that and answer those questions and again, consult with the experts. So in general, I know that we're not talking about any one particular medication, but in general for antidepressants in pregnancy and breastfeeding, after doing the risk benefit, what that would look like for an individual, most of the time, do you find that patients are staying on or going on antidepressant medication or anti-anxiety in pregnancy or breastfeeding?
I would say a lot of times patients will stay on their antidepressants and their anti-anxiety medications. I would say that because they have come to the point where they've been willing to ask for help or willing to get on medication or recognizing that they needed something and tried it and it was successful, that they kind of have that comparison for saying, this is how I was before the medication, this is how I was after the medication. I feel comfortable continuing this. I see a lot of that patients want to continue it based on how they're able to function in their day-to-day life. I honestly feel like our postpartum patients or our patients that haven't been on anything before are at more of a disadvantage because they don't have that feeling. They don't have that comparison. So I'm telling them that these are the things that may improve on these medications, and this is why we would recommend them, and we have to kind of think about risks and benefits. But I do think that they struggle a little bit more because they don't have that benefit. They don't have that feeling of feeling better, of feeling more functional.
Sure.
To compare it to. So I think they get focused on the risks more because they are so concerned about risks, and they don't have a perceived benefit. Again, having that conversation about it's okay to take care of yourself and reminding them that their outcomes are intertwined with their family's outcomes and with their baby's outcomes. And it's not just about doing every wonderful thing that you can always do and there's always a perfect answer of taking care of your baby. It's making sure that you're taking care of both of you because both of your outcomes are again, intertwined.
Christy, thank you so much for joining us today. You know, this is a little bit different from the podcasts that we usually do. Usually we have a really specific medication or, you know, we're talking about COVID or the vaccines, something really, really specific. And I know that this was a little bit more broad, but part of it is because things like maternal mental health, so during pregnancy, during the postpartum period, is something that is being talked about more than ever before, but still, you know, sometimes is shrouded in mystery or secrecy, and people are trying to change that, to be fair. So in the recent past, Meghan Markle has come out and talked about her struggles, and, you know, when celebrities do it, you know, there's a mixed bag there, but when it continues to highlight, you know, that these issues are there, you know, that people are struggling, that people have questions. It helps normalize it, if you will. I don't really like that word, but that's what it does. It makes it more mainstream. It encourages more people to talk about it. And that reminds me, you know, of things like pregnancy loss. You know, for a long time, it wasn't ever mentioned except in secret or with your provider or with really close friends or relatives. And now it is something that people feel more comfortable sharing in certain instances. And that's our hope with these conditions like depression, like anxiety, bipolar disorder, mental health in general. It's so important, especially in these crazy times. We're kind of in a pandemic time. We're kind of not. We're in and out. Honestly, we don't even know, I feel. Or I don't even know. Let me say that. Let me not speak for the world, but I will say that half the time I don't know what we're in, what we're doing. I just know that it's impacting people in a lot of different ways, and people are still trying so hard to go on with their lives, have their families, grow their families, raise their families, and help themselves. And so just talking about this, I'm so grateful that you came here to have this conversation with us to help us get the word out. I know you're doing that through your clinic, and much appreciation there, and lots of other providers are too. Kudos to all of you. And thanks for being here for our audience and giving this information also. But before I let you go, I'm wondering if there is something that you would like to leave our audience with today.
Yeah, so I would say that it is important that we get that information out there and that we think about treating, you know, both mother and baby when we're thinking about medications or even any sort of management. Healthcare is a team sport, and there's lots of different providers that have different perspectives and different educational backgrounds and expertise that can really provide helpful and good information to both patients and providers. And I would like to put a plug in today for our pharmacists and that part of the team being able to have some medication expertise and providing that information to both our patients and our providers. And I think the most important thing to think about when you're thinking about medications in this arena is that one size does not fit all. There's not a perfect answer of this is perfectly safe or this is incredibly risky. There is a risk-benefit weighing that needs to take place.
Yes, Christy, and I agree. Absolutely. Shout out to the pharmacist. And Christy, again, thank you so much for being here with us today. And thank you to the audience. Thank you so much for listening to our podcast. We're so happy to be able to bring you this information. And we are going to talk about maternal mental health in future podcast episodes. We've talked about it before, and we are going to talk about it again because it's important enough to keep talking about it, to keep having these conversations, different perspectives, to talk about medication and anything that we feel is going to be valuable to the listeners. Now, we also take suggestions. So if there's something you want to hear about on the podcast, about maternal mental health, about anything, then just let us know. So you can email us your ideas at contactus@mothertobaby.org. And if you want to be on the podcast, if you have a burning question, if you're an expert and you want to lend your expertise, we want you. We want to bring you to our audience. And if you just have some questions that need to be answered, there are lots of different ways to contact us. You can always call us. Our phone number is 866-626-6847. You can text us at 855-999-3525. You can visit our website, MotherToBaby.org. And from the website, you can chat with us. You can also email us from the website, or you can just look around the website. We have lots of information. So we have links to old episodes of the podcast. We have baby blogs. We have fact sheets. And we have informational pages about many different topics. So things like COVID-19, vaccines, and pregnancy and breastfeeding. And of course, we hope you'll join us again for future podcast episodes. You can catch our podcast on Spotify, iTunes, or however you listen to podcasts. Don't forget to subscribe so that way you never miss a new episode, and you can go back and listen to episodes from the past. And more than anything, I just wanted to thank you all for continuing to support our podcast. We're so happy to do it, but we couldn't do it without you. And so if there's anything that you have a question about, MotherToBaby is here for you. So please feel free to contact us, and we would be happy to help. Take care.
MotherToBaby is a service of the nonprofit organization of Teratology Information Specialists and supported by the Health Resources and Service Administration of the U.S. Department of Health and Human Services. It's made possible through generous donations from listeners like you. To learn more about MotherToBaby, please visit mothertobaby.org.